Colleen Hammond says she used to have the attitude toward healthcare that, if something isn't broken, you shouldn't try to fix it. The 69-year-old Oneonta resident had never been screened for colon cancer before she was diagnosed 2 years ago. Now I'm an advocate around here for colonoscopies, she said. I tell everybody to just go do it. The uncomfortable exam is still the primary tool doctors use to diagnose colorectal cancers, which are the third most common cancer among men and women, and the second biggest cancer killer, according to the Centers for Disease Control and Prevention. They estimate that, if all adults aged 50 or older had regular screening tests, as many as 60% of the deaths from colorectal cancer could be prevented. The screening rate in New York State is about 69%, but that number mostly represents adults older than 50 who have had a colonoscopy in the past 10 years. It isn't enough to make a real dent in the mortality and incidence of colorectal cancers, according to Dr. Ozairul Monzon, a specialist in colorectal surgery at Bassett Medical Center. We're not screening the right amount of people, Monzon said. I think with the high incidence in this country and tendency to present in younger people, we should be doing it starting at age 40 and every 5 years. The current screening recommendations still have the intention of diagnosing cancers when they should really be diagnosing polyps, Monzon said. Most colorectal cancers arise from polyps, with the progression taking about 5 to 10 years. Stool tests are still inadequate as a standalone for diagnosis and have a relatively high rate of false positives and negatives, Monzon said. Colonoscopies can also be imprecise and are an inconvenience, requiring preparation, sedation and aftercare. Colon cancer is a disease of developed countries, he said, noting that he only saw one case during medical training in his native Guatemala. People in their 40s and younger are at a higher risk of death from the disease because it is often caught at a later stage. The proportion of cases found in adults younger than 50 increased to 11% in 2013, up from 6% in 1990, according to the American Cancer Society. Rates have been increasing for every generation born after 1950. With diets high in fat and refined sugars, it makes sense that we will not only have colon cancer, but in younger people, Monzon said. A sedentary lifestyle also increases a person's risk. Most who develop colon cancers don't have a genetically inherited cause, according to the Mayo Clinic and other sources. The government needs to make serious investments in prevention, he said, but admits it is an enormous proposal for a country as large as the United States with such a high prevalence. The undertaking that going for a colonoscopy can be for people who live long distances from clinics and hospitals makes prevention all the more important for people in rural areas, he said. Screening rates in the Mohawk Valley and Southern Tier regions lag a few percentage points behind the state average, according to the most recent information from the State Department of Health. Heidi Bond, public health director for Otsego County, said that people older than 50 should talk with their doctors about the best screening tools for them, and stool tests might be a more feasible option for some people. The Mohawk Valley Population Health Improvement Program cites a 2004 study on direct mailings of fecal occult blood tests as a promising practice for increasing screenings of colorectal cancers. Results of the tests were sent to participants' primary care providers, and the program was found to increase self-reported screening adherence. Aaron Jerome, staff writer, may be reached at 607,417,221 or at eJerome@thedailystar.com. Follow her on Twitter at @dsarange.